today's Kids Connection, we're focusing on what can be a very fun time of the day for kiddos, but it can also be a time that can present some challenges. Bath time. Brianna Mittelsteadt is joining us from Red Door Pediatric Therapy to take a closer look, and thank you for being here. So first, parents can start to look for certain skills at bath time based on their child's age. Can you tell us more about that?
Yes, for sure. So at the age of 2, a child should be able to maintain a safe position in the bathtub. So for instance, sitting versus standing. At the age of 3, they should be able to get in and out of the bathtub successfully without falling. 4, they should show some interest in washing themselves and rinsing themselves off. So identifying some body parts and participating in the task. At 5 to 6, you'll see them start to show interest or actually do very well at washing themselves, rinsing and drying. And then by the age of 7, they should be fully independent with bathing skills, including their hair and their body.
I always like when you break down some of these things you can expect by age, because there are certain things with parents that we just tend to do for our kids all the time. And for me, bath time is one of them. So now I see some areas that we can try to move towards some independence, but you also see that you can see some difficulties start to arise with bath time. Now, what types of difficulties would you see there?
Sure. As a child gets older, you might see difficulties with motor coordination when they're washing themselves. So using 2 hands together when washing can be tricky, or they're not using enough pressure to wash their hair. You might see trouble with sequencing. So they don't know what step comes next. Sometimes thoroughness is an issue. So they're maybe not washing effectively, maybe getting the leg once versus however many times they should be, or they're not rinsing their hair out thoroughly enough. Other areas of concern that you might see would be tactile sensitivity. So when they're washing their hair or they're washing their face, you might see some sensitivity to the face, body, or hair, or balance concerns.
Okay, lots of different options there, but you do have some strategies on how families can work through these and get to a point that you can get bath time done effectively. What do you recommend?
Yes, so when we're looking at concerns with motor coordination, you're going to want to practice outside the bathtub as well, on self or just a doll or pretend play. You can use songs like Head, Shoulders, Knees, and Toes to practice some of this. Other suggestions would be watching like a YouTube video simulating bath time, just to kind of practice on top of just doing it inside the tub. Other strategies to think about would be to integrate play tasks that require 2 hands together. So like Legos or any type of string bead activity require using 2 hands. Consider using a loofah or a mitt when washing versus using a rag. This just decreases the coordination that's needed with the whole hand. It takes out that component. For a kiddo that's maybe struggling with some sequencing concerns, we always recommend using visual support. So I'll show you a couple of these today. So for a younger child, you might see we use something like this. This breaks the body parts down so that they're assisting with thoroughness and they're sequencing all areas and washing appropriately. For an older child, you might see us use something like this. This breaks down the steps even more, and it also has words along with it to help them with sequencing. So a child that is having trouble with thoroughness, you might want to consider counting when washing. So they have to count to 10 as they're washing their arm, or count to 10 as they're washing their legs, just so that they're thoroughly washing each area.
These are all great ideas. I really like that you're giving us some ways to support it too. Let me just ask you one more thing you talked about the loofah versus a rag to wash. Did you say that you recommend using the rag because it requires more of your full hand movement? Is that what you said?
We would actually recommend using the loofah or a mitt type rag. So something like this, where it takes them having to hold the rag itself, that takes the component out of it, the motor coordination component. So they're able to just wash with their whole hand versus having to hold the rag and wash at the same time.
Great. Okay, now here's one more thing that I do run into during bath time. It's getting the hair wet. So if you're having trouble getting your child to lay their head down into the water, do you have alternatives to that?
We do. Some children are very tactile or touch sensitive, so when you're dumping the water over their head, that can cause increased difficulties. You might see crying. We always recommend that the child lay down in the tub to rinse their hair versus dumping it over their head. That's always helpful. And then the parent can then just rinse their hair in the bathtub versus getting it all over their face. Again, counting prep is also helpful when it comes to rinsing. So let them know that you're going to rinse it 3 times and prep them before you do so.
Great strategies. Once again, knowing that, there may be difficulties in your day-to-day tasks, but there are certainly ways to work through them. And you guys at Red Door Pediatric are full of options and different alternatives that are going to work for your family. So if we have questions for you guys, where can we find Red Door Pediatric Therapy?
Yes, you can find us in Bismarck, Minot, in our Grand Forks location. You can call our central scheduling at 701-222-3175.
Okay, thank you so much for joining us today. We hope people at home found some useful tips that they can put into use, and we'll see you guys again later. Thank you, Brianna.
Thank you.
More North Dakota Today is coming up after this break. Stay with us.